Namaste Vidya, Hamisha खुश रहो Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture, we are going to discuss about obesity. What is obesity? Obesity is a state of excessive adipose tissue mass. It should not be defined by the body weight alone, as muscular individuals may be overweight by arbitrary standards without having increased adiposity. The most widely used method to classify weight status and risk of disease is the body mass index, or BMI. It is equal to weight divided by height squared in kg per meter square. At a similar BMI, women have more body fat than men. Obesity is widely regarded as a pandemic with potentially disastrous consequences for human health. Obesity is associated with an increased risk of multiple health problems, including hypertension, type 2 diabetes, dyslipidemia, obstructive sleep apnea, non-alcoholic fatty liver disease, degenerative joint disease, and some malignancies. Body fat distribution. The increased intra-abdominal fat causes central obesity, that is abdominal, visceral, android, or apple-shaped. The central obesity is more common in men and is more closely associated with type 2 diabetes, the metabolic syndrome, and cardiovascular diseases. The subcutaneous fat accumulation causes generalized gynoid or pear-shaped obesity, is more common in females. Etiology. The obesity can result from increased energy intake and decreased energy expenditure, or a combination of the two. Excess accumulation of body fat is the consequence of environmental and genetic factors, social factors, and economic conditions also represent important influences. The cause of obesity can be divided into primary and secondary. The primary causes includes a rare single gene disorders that have been identified that lead to severe childhood obesity, melanocortin 4 receptor. Syndromic obesity forms includes Prader-Willi syndrome and Lawrence-Mood-Badel syndrome. The secondary causes of obesity are hypothalamic injury, hypothyroidism, Cushing syndrome, hypogonadism, and drug-induced weight gain that is also common. Now, assessment or the classification of obesity. The classification of the weight status and risk of the disease. If the BMI of a patient is less than 18.5 kilogram per meter square, he or she is considered as underweight. If the BMI is between 18.5 to 24.9, the person is considered as healthy weight. If the BMI is between 25.0 to 29.9, then he is considered overweight and there is a risk of disease is increased. If the BMI is between 30.0 to 34.9 kg per meter square, then he is known as obese and the risk of disease is high. He belongs to class 1 obese person. If the BMI is between 35.0 to 39.9, he is considered obese with obesity class 2 and the risk of disease very high. And if the BMI of the patient is greater than 40, then he is considered extremely obese with obesity class 3, and the risk of disease are extremely high. Now we come to the clinical features of obesity. There is increased mortality from obesity. It is primarily due to cardiovascular diseases, hypertension, gallbladder diseases, diabetes mellitus, and several types of cancers. There is sleep apnea. Obesity is also associated with an increased incidence of steatohepatitis, gastroesophageal reflux disease, osteoarthritis, gout, back pain, skin infections, and depression. Hypogonadism in male and infertility in both the sexes are prevalent in obesity. How will you manage the case of obesity? We have multiple approaches in the management of obesity. Number one is the diet therapy, in which the primary focus of the diet therapy is to reduce overall calorie consumption, taking smaller portion sizes, eating more fruits and vegetables. Next, we have physical activity therapy, which is a combination of dietary modifications and exercise, and is most effective behavioral approach. Next, we have the behavioral therapy, that is the self-monitoring techniques like stress management, stimulus control, social support, problem solving, and cognitive restructuring. Next, we have certain diseases in the treatment of obesity, that is management by pharmacotherapy. There are different kinds of medications for obesity that have been classified into two major categories. Number first is appetite suppressant, that is anorexians like lorcaserin and phentermine or topiramate. And the second one is gastrointestinal fat blockers that reduce the absorption of selective macronutrients such as fat from the gastrointestinal tract. There are certain other medications like centrally acting anorexiant medications which act by increasing the satiety and decreasing the hunger. These help the patient to reduce calorific intake without sense of deprivation. Now we come to the management by surgery part. By surgery, we can perform bariatric surgery that is considered for the patient with severe obesity, that is with BMI greater than 40 kg per meter square. And there is weight loss surgeries that have traditionally been classified into three categories on the basis of anatomical changes like restrictive malabsorptive, and malabsorptive. The three restrictive malabsorptive bypass produces combined elements of gastric restriction and selective malabsorption. The procedures are Roxanne Y gastric bypass, biliopancreatic diversion, and biliopancreatic diversion with duodenal stitch. Next, we have the complications because of obesity. There are various complications that can occur due to obesity. They can be psychosocial complications like the eating disorders, poor self-esteem, body image disorder, social isolation and stigmatism, and depression. The pulmonary complication includes exercise intolerance, obstructive sleep apnea, asthma. The gastrointestinal complication includes the gallstone, gastroesophageal reflux, non-alcoholic fatty liver disease, and colon cancer. The renal complications are the glomerulosclerosis and the renal cancer. Musculoskeletal like ankle sprain, flat foot, tibia vera, osteoarthritis, and back pain. There are certain neurological complications like pseudotumor cerebri, idiopathic intracranial hypertension, cardiovascular hypertension, dyslipidemia, coagulopathy, chronic inflammation, endothelial dysfunction. There are various endocrine complications like insulin resistance, impaired fasting glucose or glucose tolerance, type 2 diabetes, precocious puberty, menstrual irregularities, polycystic ovary syndrome in females, hormone-related cancers, breast, endometrium, and prostate. So this was all about obesity. In the next lecture, we are going to discuss about the temperature disorders like hypothermia. This session was powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.